Yes, of course. Yeah. I'll do the introduction to that. Right. Hello, everybody. Hello. Dr. Dana Goldberg, thank you all for coming today to our informational session about Sculptra. It's a great product, but it really is different than the other fillers, and a lot of people are not exposed to it and don't know about it. I do want to let all of you that are here in the office know that we are doing a webcast of this presentation. So if you turn around, you will be on camera. If you do not turn around, you will not be on camera. Choose accordingly. So how many of you have actually heard about Sculptra before tonight's event? Two people. So this is a great place for us all to learn about this product. I've actually used it. I plan on doing another session extremely soon. I keep putting it off. I don't know why. Probably because I can't do a glass of wine at night for a day or two beforehand to avoid bruising, but it's a great product. And Ryan Brown, who's my PA here, is going to come up first and spend a few minutes, like 5 minutes, just explaining the science behind the product and a little bit about how it works in the aging process itself. And then I'll come up and go through some of the before and after pictures. This product can really do for you. So here's Ryan.
All right. Well, first of all, thank you everybody for coming. My name is Ryan Brown. I am new to this practice, however, I do have pretty significant experience in plastic surgery. I was trained down at Cleveland Clinic down in Fort Lauderdale. And I'm just going to kind of explain some of the basics of how this product works, how different products work, and kind of the science behind it. Go ahead, Marcelo. You can skip to the next one. All right, so there are basically three things that kind of attribute to facial aging. The first one is kind of bone atrophy, and what that means is basically the bone can shrink. So if you look here, we're going to look at three different parts. So if we look kind of at the zygomatic bone, or the cheekbone, you can really kind of see how on this one, it's much thinner than it is over here. You can also see this orbit, or the eye socket, kind of get a little bit bigger. And the way I like to think about it is kind of like an ice cream cone with an ice cream scoop on top. As we get older, that ice cream cone gets a little bit bigger, but the scoop stays the same size. So the scoop actually starts sucking in a little bit. So you get eye regression, meaning your eyes will actually go in a little bit. Thirdly, we have this jawbone here, the mandible. It's a very common place for people to lose bone as well. And you can really tell, the 20-year-old versus the 55-year-old, the thickness of the mandible versus the thinness. Now, we all know about bone loss. We all know about osteoporosis. We always think about elderlies breaking hips, breaking bones. But not many people think about it in the face. And it is a big cause to people looking older. That's Marcelo. All right, next, fat atrophy. So there are pockets in the face. When people are younger, once again, this is a younger face versus an older face. And these pockets in the face help keep people youthful. And if you ever go to the mall or you have a friend that has a kid, look at their face and look at the difference. Look how puffy their cheeks are. Look at a 15-year-old's face versus an 80-year-old's face, and you will really see that a lot of this fat will start to kind of follow gravity and go down. I like to say people, when they're younger, you kind of have a funnel. So their face looks more like this. However, as they get older, their face starts to get more square. And what that's from is basically in this area, in that cheek area, that fat is slowly starting to go down. Go ahead, Marcel. And the last is going to be collagen. And collagen is the younger skin versus the older skin. So I like to look at collagen kind of like a pillowcase. So if you think about it, everyone has their favorite pillows, whether it's your favorite pillow now or when you were a kid, that you loved, you slept on it every single night, and the pillow started to have spots in it, where it wasn't as full as it used to be, it wasn't as thick as it used to be. And there's kind of two ways to fix that pillow. Way number one is we can cut it, make the pillow smaller, squeeze all the fluff that's in there together. Way number two is basically to fill it. So we refill it with more fillers and kind of blow it back up. It's kind of the two options that we have for trying to make someone look younger. To go in and fill it is basically us using fillers or Sculptra, something like that. As far as cutting the pillow, it would be more like a facelift. So those are kind of the two options to really get you looking a lot younger. Go ahead. All right, so this kind of is a segue into what do we use for what? So when do we use Dysport or Botox versus fillers versus Sculptra and all this stuff? Because some people say, I need Botox Botox down here, right? You don't really understand it, which is, most people don't. So Botox is mostly going to be used up on the forehead or kind of around eyes, and it's going to be for small lines. It's going to be lines from this muscle constantly squeezing, called the frontalis muscle. You can have lines over here as well. What the Botox does is it basically stops that muscle contraction. When you stop that muscle contraction, over time you stop the lines. Number 2 is going to be fillers. So fillers are going to have kind of 2 options. Option number 1 is if deep lines, one here has a if people have really deep lines, we can go in and inject some of the filler into the line. If Botox isn't enough, sometimes it takes multiple modalities to really get people to where they want. We can also increase the volume in those areas that we talked about before, in the cheek, in the jaw. And then number 3 is going to be the Sculptra product. The Sculptra product is very unique in that it can pose as any of the 3 things that we talked about. It can pose as collagen, it can pose as bone, and as fat. So it really works as a really good filler to kind of fill out those areas. Go ahead. So this is kind of the science behind how it works, and what collagen does is it goes in, and Sculptra does, it's a collagen kind of binder. So it goes in and actually helps to create more collagen in your body. The reason that it works longer than most fillers is, I don't know how many of you guys have had fillers, but if you've had fillers, the second that the filler's gone, the wrinkle comes back, the lines come back, the fullness is gone. This actually works to kind of bind to make more collagen so that it's not gone in 6 months to a year. So Sculptra has been shown to last well over 2 years in a lot of people. And the big thing is that binding right here that you see of the collagen. Now, usually when you come in, what we'll do is we'll do 1 vial on each side. 6 to 8 weeks later, we'll do 1 vial on each side, and we'll kind of go until you guys are. Some people want to be fuller, some people don't want to be as full. Once you get to that point, it's very easy to maintain. Usually we can maintain it just 1 vial per year. But to get to that point sometimes takes a little while. But I'm going to have Dr. Goldberg come over here and go over some pictures and go from there.
What I'll ask you to notice about these pictures is just your first impression of the face before and your first impression of the face after. Most people can decide how old they think somebody is, and quite frankly, whether or not they like them or not, after less than a second. These are gut instincts we have, which all relate to things scientists have now studied, like where the light reflects off the cheekbone, how much of a fold there is between the eyes, around the nose, hollowing the temples, hollowing through the jowl, whether there is a jowl. These are all things that as a surgeon I assess. But as people, you can tell the difference between somebody that looks young and old, you just don't know how you know. So as we go through these, notice, I'm going to point out some of the specifics, but really just notice the global effect, because that's what Sculptra is all about. The other fillers, I feel, are more for people who notice one specific spot. I notice I have this really deep line, but I'm happy with the rest of my face, or one particular area. People who just say, I feel tired, I feel old, I'm not exactly sure why. A lot of times it's just this loss of volume that's contributing. So replacing all of it with more of your own tissue is the way to go. So for her specifically, if you notice the shadow at the edge of this temple bone versus the lack of shadowing in that after picture, they have done a lot of studies that show the more of the eyebrow you can see, the younger you feel a person is. So by filling out that tissue and just seeing another millimeter or 2 of the eyebrow, instinctually other people will think you are younger and they won't exactly know why. So it's not that you'll look different or look fake or overplumped, you'll just look young. You notice a lot of the shadowings to the cheek, and even this pre-jowl area, the whole jawline looks smoother, the cheek looks smoother, there's not really any shadowing below the nose, and the lip actually even looks fuller and more pulled up, even though nothing has been done to the lip. So we can go to the next picture. And this is to show that Sculptra can be used for any age patient and with any concerns. Obviously, this is a patient who's in a different situation than the first patient. This patient is a candidate to have some sort of surgical procedure done, but doesn't want to still have something to offer her to just help her look less tired and a little more refreshed. We can go to the next picture, please. This patient shows what a great candidate for Sculptra is, somebody who is really missing volume. And I think the surgeon that says, yes, we should do a facelift is really missing the mark for this patient, because just pulling the skin tighter over a completely emptied out framework of a face is going to make her look like she's had a facelift, not younger. So just redoing the volume helps build the collagen in the skin and stretch the skin to its kind of plumpness that it is when you're younger, and indirectly affects all of these other folds and wrinkles. Next picture, please. And this is just another picture to show how just volumizing through the cheeks and the temples and the area before the ears reel up the face and get rid of a lot of the apparent looseness of the skin, which is more due to deflation in some patients than it is to actual sagging. So you can go to the next picture. And this picture I like because it just really shows that Sculptra can be for any age. This patient's in her 80s, and she didn't want to look 20. She didn't want no wrinkles or lines. She just wanted to look better. And by adding volume in those key places between the lid and the cheek, by building it, and by filling in the temple and this area before the jowl, it really does achieve that for her. And it's a subtle look, but she just looks better. Next picture, please. This is another shot from the other angle, the same one. And you know, everything looks much smoother, but it's not that she's had resurfacing or surgery, it's just getting the adequate volume in the area and rebuilding that collagen in her tissue. Next slide, please. This is yet another example of someone who's really pretty volume deficient. And if we were to go take a regular filler and just fill in all these lines directly, she'd be very bulky in the lower. The problem is that she doesn't have enough volume in her upper face. And by addressing that upper face, it makes the lids look better, and it also takes up a lot of the wrinkling in the lower part of the face. Next slide, please. And this is another patient who's had a tremendous transformation. And an example of just showing how where the light catches the face can make a major difference with how youthful it looks. And when Ryan was talking about that funnel effect versus the square, as we age, we lose a lot of the high volume in our cheeks and get this jowled appearance that makes everything really look square. As you replace the volume of the cheeks and create a straighter line to the chin, it reintroduces what we call the youthful triangle in plastic surgery. And it's just one of those indirect ways that people say it actually looks really good, and they really just don't know how they look good or why they look good. Next, please. And this lady actually did, she did some other things in addition to Sculptra, but it was a chemical peel and some skincare products, nothing major. Something that has very minimal downtime. Patients definitely do need different numbers of treatments. This patient had 6 vials with her treatment, so that's usually 2 vials per session. So you come in and get 1 vial on each side of the face. It's separated into 6 different syringes of products, which are injected in strategic locations. I have had it done. It is a needle in your face. It's really not that bad. We use topical anesthesia and a lot of ice. I do tell people expect to be sore for a couple of days. It feels a little like a bruise or like a sore muscle that you've worked out. And the important reason to know that ahead of time is that you do want to massage the Sculptra 5 times a day for 5 days. So 5 minutes, 5 times a day for 5 days. And that's to help make sure the product stays distributed evenly through your tissues. One of the prior concerns with Sculptra was palpable nodules in the skin from too much collagen being stimulated in one area versus other areas of the skin. I'll be honest, I actually used this product a few years ago and then briefly stopped using it, but the company reformulated the way they mix the product, the way it's injected, and I have had none of those issues since I restarted using the product. And like I said, I've used the product myself. So it is just important to be aware of that sensation and to just be able to know that you're going to be able to massage these areas and know that you're going to have to do that after the procedure. So next, please. This is actually a patient who had a facelift and really thought she looked a little too pulled and a little too tight. And just by adding the appropriate amount of volume, it just softens the result and just makes her look more refreshed and well rested. Next, please. Oh, yes, that's it. That's it. Does anybody have any questions about either the pictures that we saw or the injection process or a different? Sure. So the neck, injectables, yes. Specifically Sculptra, no, although occasionally you can get an indirect effect because if you're volumizing this area, we often inject right above the jawbone, it can decrease some of the looseness. Probably not so much for this central portion, but Dysport, which is one of the neuromuscular modulators, in cases where a lot of that pull down is due to the muscle, there's a muscle on the neck called the platysma that pulls down. In some patients, injecting just along that muscle can help it relax and smooth out so it's not pulling away from the neck. Needed skin and stretchiness of the tissues over time, and that muscle's been so stretched out that and tightened that it can't relax with a neuromuscular modulator, then surgery is really the only answer we have at this time. But some patients do try, some patients it works great for. I actually use it in my neck because I'm trying to prevent all this stuff from happening to myself. And I have many patients who get, 8 or 12 injections just along the muscle line and have very good results. Some patients don't see as much of a result.
Is that something you're injecting in the neck?
It is. That would be Dysport, the neuromuscular modulator, and
But it's not a filler.
It's not a filler. Yeah, we talk about neuromuscular modulators, fillers, and collagen stimulators. Neuromuscular modulator is made by the same company that makes Sculptra, and there's Botox, and there's actually a new one called Xeomin. I haven't had as good a success with that, so I don't currently carry it. The fillers are going to be more the ones that most people have heard about. There's a huge class called hyaluronic acid. It's Restylane, Juvederm, Juvederm Ultra Plus, Voluma. Those are all hyaluronic acids. There's another filler called Radiesse on the market, which is part hyaluronic acid, part collagen stimulator. But Sculptra is truly the only collagen stimulator that's indicated for use in all of the genital volumizing.
How do you determine whether you're a candidate for plastic surgery or for this?
So many times we will do both. I think in this day and age, many patients, like I said, would be we'd be doing them a disservice if we just offered skin tightening without revolumizing. So it's my strong opinion that volumizing should be done in conjunction with any kind of surgery. And if we're on the fence about whether you need a surgery, I really think doing the injectables and revolumizing first gives us the best chance of really assessing whether you need something. Because some patients find that they get enough of a teeny bit of brow lift and eye opening with injection of fillers and Sculptra to the temple area. You avoid a brow lift for a few years, or avoid a facelift, sometimes forever, sometimes for a few years. But I definitely think revolumizing first is the way to go, because then you're assured that you're going to look as soft and natural as possible after a surgery.
Does this work like on the eyes too? Because I have these pockets here.
Well,
Does something like that work?
It can help. It's not a replacement for lower eyelid surgery. It's not a replacement for facelift surgery if you've truly got enough laxity in the tissues and looseness that it helps to reposition. However, that said, rising through the cheeks helps push them up in a way that it camouflages that junction between the eyelid and the cheek. Marcel, if you can go back to that fat pad page. It's way back in the beginning.
It's right there too. How many lips change?
It is really pulling up patients that ask me to fill their folds. I'm now offering to fill the cheeks and to revolumize the upper face because it's just a more natural way of addressing that fold. 8-year-olds have folds. 20-year-olds have folds. It is not natural to have no folds. So just addressing aging around here with fillers is really not going to give you the best look possible. So this is what I wanted to point out. You can see as youthful shape to the face, and with youth, you have these fat pads that abut right against each other. With age, they not only descend, but they also shrink so that all of a sudden you're seeing this junction and you're seeing where your muscles connect to the eye socket and the bone. And in fact, you're losing bone too. So everything recesses and it seems like there's too much skin for the area because it's not filled out. Like you were saying with the pillowcase, you think, oh, hem the pillowcase, it's too big, tighten it, tighten it, tighten it. But it's a better approach sometimes to restuff and to refluff. And by putting a lot of volume through the cheeks, many people can hide that mid-cheek junction and look a lot younger without surgery.
Can you put your sleeve to do it? Facelift.
Yeah,
That's why I don't have anything done on.
yes, I am a baby. I hate getting injections in my face, I hate it. But it takes 10 minutes. And I have some patients that are particularly anxious, and sometimes we will prescribe patients 1 pill of Valium or Ativan or something if they have a ride to take before the procedure. Most of the time, anesthesia is not that beneficial for these filler products because the anesthesia causes some dilation of the blood vessels. When we do surgery, we often inject epinephrine in the tissues, which will counteract that. With fillers, you don't want to inject extra substances into the tissues most of the time. So I find patients just get a lot more bruising when I combine it with another surgery or do another anesthesia. So it's best to be sitting up, and most patients with the topical numbing cream we have, and with dental blocks for around the mouth if they're needed, really do well tolerating procedures. I have patients that say, I can't tolerate anything, I'm such a baby, and they tolerate it.
Do you have as a rule, an age limit that once people are there, it generally needs both? Or, I'm sitting here with my daughter, so you're trying to decide if she thinks she needs this, then obviously I need something more than that.
Well, it's not so you probably both need it, you may just need more of it. And there are some patients that, because of nutrition or other factors in their lives, are not as capable of producing collagen. So there are some patients that will not get as great a result with this treatment. For patients who I feel are at high nutritional risk, we'll start a multivitamin regimen and do some supplements with protein shakes and some other nutritional products to help that collagen process. But generally, younger people may need 2 or 4 vials, usually at least 4. Older patients may need 6 or 7 or 8 before they get the result they're looking for. And then yearly, it's just 1 or 2 to kind of maintain that look. You've got that collagen and you're just continuing to stimulate it.
How long is the healing process of bruising there?
Actually, there's usually very little bruising, if any. Because we inject it, the product's mixed with saline, you get 6 milliliters of fluid injected into various parts of the face. So actually, a lot of patients like the way they look right after because they're a little puffy and it kind of simulates what the result's going to look like. But within 2-3 days, all of that puffiness is gone. And then you will wait at least 4, maybe 6 weeks before you start to feel and see the difference in your tissues. And that's when we would do the second treatment session. Tonight, our cost is $50 per vial. We generally do 2 vials per treatment because we do 1 vial for each half of the face. Very few patients will respond to 2 vials alone, although I have a few patients who have used it at other offices and said, I just want to do the temples, and we'll split 1 vial between them. There are situations like that, but most patients are going to use 2 to 4 vials. And I'm going to have Kim come up and it before the event. Any other questions about fillers or clinical?
Yeah, can you address the difference between the lactic acid, the stimulator, and Juvederm, the filler?
Right. So polylactic acid is similar to the material they use to make absorbable sutures. So essentially, it's a complex sugar, and its role is to stimulate your body's collagen production. So it's injected into very general areas mixed with saline, so it spreads throughout the tissues and stimulates the tissue. Fillers like Juvederm or Restylane are hyaluronic acids. So they're a gel. They're not a suspension of particles in a fluid. And the gel is meant to be injected exactly where you want that volume. So if you see a hollow spot here, you inject it right here. You see a wrinkle, you inject it right in the wrinkle. Usually right in the deep layer of the skin.
So are some candidates more a filler candidate than a stimulator? Like older?
Occasionally patients who have one particular area where they say, I don't care about the rest of my face, I literally just want this addressed. Sometimes we'll still do a filler. Lips, we always do a filler. If you still have this line here, some of those fillers will be appropriate. I find that a lot of times it's kind of a both response.
You do fillers?
Absolutely, yeah. And the fine lines around the mouth, Sculptra may affect the lip a little bit, but it's not going to directly affect the lip. So sometimes we do resurfacing and other fillers and surgery. I mean, Sculptra's not the only product I use. It just happens to be pretty unique and does apply to a wide range of patients. I mean, there's patients in their 30s and 80s that both get a benefit from the same products.
Okay, all right, any questions from the web participants? Otherwise,
No,
Kim.
I was blank.
Okay, all right. Kim, I'll have you come up and talk about our specialist.
Hi, I'm Kim Sanchez. I'm the coordinator here. I'm just going to kind of go over this book. I do want everybody to kind of refer to, once you've done the talk, look through the pages. Like she said, everybody's a little bit different as to what they need and how much they need. We are doing a special tonight where it's buy 3 vials, get 1 vial free. The vials are $7.50 a piece. And like, Ryan mentioned and Dr. Goldberg mentioned, you do definitely usually need 2 sessions to get the full correction. Some people need more than that. So it is a very, very good offer. Mentioned the fact that usually the first session we use about 2 vials, would you say, Ryan? On the first session alone. The other offer is that if you buy them tonight, you're also entered into a raffle to get 2 vials for free. So then if you think about it, you can either get the reimbursement back on those that you paid for, or you can save them for the next ones to come. Like they said, each year you're using probably a vial for like the maintenance on it. But look through the book, see the different pictures at different age brackets and different correction as to what people needed and used. But definitely tonight, that is one really good offer to jump on if it's something that you're considering doing. And like I said, Dr. Goldberg's used it. It's for every different age bracket. Can definitely use Sculptra. People who are thinning out, I will be using it. I'm very thin. I metabolize things really, really fast. So the first time that I lose 1 pound, 2 pounds, and my face just sinks right in. So not that I'm old or I'm really wrinkled, but my face loses the volume, and then it starts to make you look like either you're tired or you're sick. You get those things that people ask you. So it plumps the face back up, gives the youthful look back to the skin, as you've seen through everything. The other offer we're doing is on Dysport. I know they did talk about that. Dysport is for these muscles up here, through the glabella, through the pros. And that is you're buying one, I think it is, we're doing buy one, get one at half off.
Per unit, yeah.
Per unit, which is awesome. That's a really, really good deal. So you guys can kind of mix and mingle with all of us and kind of talk more about, talk to Dr. Goldberg as to what it is that you think. You may ask a few more questions, but definitely consider the offers tonight because they are really good offers.
How much is the disc?
Dysport.
The Dysport goes by per unit. Some offices do per area. Here we choose to do per unit because everybody's different. So somebody may need more, somebody may need less, and the person who needs less is paying more. So we do per unit. I think per unit on Dysport is $5, $4.
What is it?
460.
$460, sorry. $460 per unit.
What's a normal?
Normal correction, say if we're talking about the glabella, would be like 50 units. So times that, so we can work it all up for you guys and kind of tell you, what the prices would be.
Instead of using Botox.
Botox runs $14 a unit.
So
So
is it the same thing as the Dysport?
are they the same thing as Dysport?
No, I know it's not the same thing, but.
I can address
Yeah.
this.
You want to hear that more on that question?
Yeah, they are different brand names of essentially the same product.
Right.
They are both botulinum toxin derivatives. They're both produced in labs. They're formulated differently so that roughly, whereas most people would use 20 units of Botox in the glabella or 20 to 24 for the pros, most people are using 50 to 60 units of Dysport because that's the treatment dose for that product. So it's priced much less per unit because you're using more units. And for our patients, it works out that if you do use the Dysport, it's a better price than the Botox.
But if you have lines as deep as I have here, you think it's subject to filler.
Sometimes. So those lines are because.
I got a whole right.
Yeah, when you move, you actually bend, and just like a credit card, if you bend in the same spot over and over again, it breaks down and weakens. You're breaking down collagen in those areas. So if you do the Dysport or Botox, your body will have a chance without that muscle movement to rebuild collagen in that area. For some patients that have deeper wrinkles, sometimes you need to get that treatment for 8 months or a year, which would be 2 or 3 sessions of the treatment to really let your body fully recover. Occasionally, I still have patients that still have lines even after that time period. We do use filler. But if you say, okay, now I've got filler, I don't see the line, I'm going to stop doing the neuromodulator treatment. Unfortunately, your body is still going to be breaking down your own collagen. You're just not going to see it because you have that plumper in there to kind of hide the fact. So I do still recommend getting Dysport to weaken those muscles, even if you require a filler. Just maintain it, that way you're not breaking down further collagen.
Because that's what really Botox does. It paralyzes the muscle so that it doesn't make it.
Correct.
Once I have it, it's not going to get better.
Well, it can though, because if you and you get either Botox or Dysport religiously every 3 to 5 months, whenever it wears off for you, you don't want it to wear off completely and start wrinkling again. But as soon as you notice that muscle movement, or on a scheduled basis, even before you really notice it, if you maintain those treatments, your body will build new collagen, and you may not maintain those lines. It's just a matter of being regular with it.
Right. Same thing with fillers. Like I had really, really deep, we call parentheses, on this area here. I did 1 round on the fillers, and my body just rebuilt that collagen, and I didn't have to use it again. I haven't had to use it again. But the same thing that we think about, as the younger you are, you start using Dysport, you're preventing yourself. It's kind of like stopping things in time is preventing it to how much worse the wrinkles could become.
Yeah. What is deep now,
Does this,
imagine how deep it'll be in
does
20
this
years.
actually help you prevent down the road?
The
Does this
Sculptra,
help you prevent?
That's how it's different than the other products. The Dysport and the Botox will also help prevent aging, but they can only prevent the collagen breakdown that's due to muscle motion in particular areas. It's a very narrow spectrum of what it addresses. This product will rebuild collagen in your tissues essentially all over the face. There are a few areas we don't inject it, the nose, the lips, basically the central portion of the face. But everywhere else, the cheeks, the temples, the chin, you're building collagen in those areas, so it is making your skin younger.
So is it gonna give you a fat face?
So,
Good question, good question.
Yeah, I have had some patients with fuller faces, and I remember one of the physicians that trained me showed this picture of this guy as before, and I thought, there is no way this guy needs Sculptra. Full cheeks, big face, he must have weighed 300 pounds. However, he just looked better. He looked like a college linebacker instead of some fat dude when he was finished with the injections because he had the volume here to balance out the fullness that he had in the rest of the face. So I have many patients that are concerned with any filler, let alone Sculptra, because they think they're gonna look fat. We're putting volume where you need volume in the face, where your bone structure used to be, where you lose it as you age. So it won't make you look fat, it's just gonna make your face shape more youthful and make you look more like you did years ago.
It won't do, I mean, I see people that their lips look like that.
That's too much filler to look.
Yeah, that's what I'm worried about.
And just so everybody in this audience and everybody out there on the webinar knows, traditional fillers, like those hyaluronic acid fillers that are usually used in the lips and sometimes the tear troughs, can be dissolved. Sculptra cannot be dissolved, but since we do it by session, if you feel you have enough fullness after the first 2 vials, after 1 session, you stop. If you feel like after 2 sessions you have enough volume, you stop. And none of these products are permanent. So you're going to continue to lose volume as you age, and these products will continue to slowly break. You don't have to be concerned about over-volumizing as long as you're communicating clearly with me what you want. Other surgeons, I can't promise anything for, but yeah, I don't tend to make people over-volume. Good. Yes. Is that? No, definitely. No.
How about switching? Let's say you started with fillers and then you don't like the result and you go to Sculptra.
There is no contraindication, and
The other way around.
yes, you look Sculptra up out of the room. I actually have Sculptra, Voluma, and Juvenile Plus in my face. Kim has had multiple different products. I use
Doesn't matter.
Botox. They're different products, so they do address slightly different areas of the face. And I did the Sculptra through here, but we were doing a training session for Voluma, and I thought, why the heck not? I'll put some in here, and they're very mix and match. Some patients, those 21 fat pockets in the face, everybody loses them at a different rate. And some people even lose them at a different rate on each side of the face. So sometimes if you do Sculptra and stimulate collagen evenly, you may have a little asymmetry. You can either choose to do 1 vial extra in those spots, or you get a little Restylane or a little other filler and you just pump that area specifically with that. All right, well, I thank everybody for coming. You're welcome to have a little more to drink and some food and.
Definitely encourage you to mix and mingle.
Yes.
Consultations.
Yeah, we will be
Yes,
available if anybody wants to come up specifically, and just talk about their Sculptra might be right for them and their, Yeah, absolutely. Yes.
So definitely have a drink, mix and mingle. There is, one of the reps here from Company and South, so you guys can talk to her as well. Dr. Goldberg, make sure you flat out tell you about it. Specifically about this break, guys. You know, when you're right or not right? The best time right now is to have that interaction with her and kind of see, what's going to work for you. All right? And if you guys do get one of us us to help you guys, you know, we'll bring it out, you guys will pay for it, and we have credit and schedule the appointments. Yeah. All right, you're very welcome.